Not too much to read, but so you know that it's surgical anatomy station I'm going to ask you about. Right. So if you have read and understood, considering its surgical anatomy station, kindly please tell me if you can recognize what kind of image are you looking at?
This angiogram of the brain.
Okay, more precisely, more specifically, if you can, cerebral angiogram. Okay, right.
Cerebral angiogram.
There are certain structures labeled from A to F. Can you identify number A, please?
Is internal carotid artery.
Very good. And B, please.
Anterior communicating artery.
Very good. C.
Anterior cerebral artery.
Yes, good. D, please.
Medial cerebral artery.
All right. E, please.
This basilar artery.
Very nice. Good. F, please.
Posterior communicating artery.
Yes, very good. All right. Can you tell me what else can you see? If you can tell me exactly, wait. I wanted to tell you where exactly would you be able to locate vertebral artery and the basilar artery? In which view would you be able to see these two vessels? Okay, we'll move on. Can you, if you're looking at this image, right? Can you identify this structure with which is pointed at with the arrow?
This is anterior, and the arrow is anterior.
I don't know, I'm asking.
Okay, this is the anterior cerebral artery.
Okay. All right. If a patient presents with the if a patient presents with the middle cerebral artery infarct, what would be the signs that you'll be able to recognize it with?
Okay, first the patient will come with hemiparesis in the contralateral side, upper and lower.
Okay.
And will have aphasia if it is occurring in the dominant hemisphere.
Yes.
And facial palsy in the contralateral side in the lower half of the body.
And about the extremities?
No, but contralateral side.
Contralateral, yes. Upper and lower, both. All right, very good. This is basically its aneurysm. It's stump-like. So it's not just the middle cerebral artery, it's the aneurysm of middle cerebral artery, most likely. Where is my cursor? Yes. See? Okay, good. Can you please tell me already, okay, it's already given there. I wanted to hide these and ask you, but then, okay, you can already see. What kind of image is this that you're looking at?
Cerebral angiogram.
Yes. And these labels, if you can tell me what this label is, MCA is what?
This medial cerebral artery.
Okay. Can you please tell me before this middle cerebral artery and ACA is given off, which vessel is given out as a branch before these two vessels?
Yes.
It
Which
gives-
can you repeat the question?
Yes, before there is before there is division or giving out of MCA and ACA, this vessel, which is called internal carotid artery, it gives out one branch. Can you name that branch? Ophthalmic artery.
Ophthalmic, yes.
Yes.
Ophthalmic artery.
All right. Okay. If we come back to the previous image, I told you this is the aneurysm. Can you tell me what happens if there is rupture of this aneurysm?
Subarachnoid hemorrhage will
Yes.
happen.
How would you differentiate it from the other types of headaches or hemorrhages, or what are the other types of hemorrhages that can occur in the brain?
Extradural hemorrhage.
Okay. How would you differentiate subarachnoid with the extradural?
Pass this question.
Okay. Right. Can you tell me the course of vertebral artery?
Okay, vertebral artery, it's come from subarachnoid from subclavian artery.
Okay.
And then go upwards through foramen transversum from C7 to C1, C2. And in C1, it passes in the posterior arch of C1. Then it goes into by foramen magnum into the skull.
Yes. Then?
And then pass in the midbrain and below the bones, and pass upward and medially.
Yes.
And before reach the bones, it communicate together to the
Yes.
two vertebral artery to give basilar artery.
Yes.
That is all
Where exactly this happens?
Below the bones, inferior to the bone.
Okay. Inferior to the bones, where exactly? Anterior aspect of the medulla oblongata. And then, no, that is from the, okay, you're telling me the end, right? To form the basilar artery in the lower border of the bones, right? Okay. Can you also tell me the branches, all the branches of internal carotid artery before it enters the skull?
It give
Does it give any branch before it enters the skull?
yes, no.
No. Okay, good. Right. What more I had to ask you? Right. You've told me about the Berry aneurysm. All right. There is another pathological condition which is associated with the Berry aneurysm. What is that? Another clinical condition in patients who have Berry aneurysm, they also present with another condition somewhere else in the body. If you can think and tell me. Mostly patients present with polycystic kidney diseases.
Yes.
Right. So do you know the difference how polycystic kidney disease of adult is different from polycystic kidney disease of a child?
Can I pass this question also?
Okay, bell is gone. Right. So that was it. Thank you.